How did medieval public health change after the plague? Have you ever wondered how a catastrophic event like the Bubonic Plague transformed public health in medieval Europe? The Black Death, which struck from 1347 to 1350, caused massive loss of life, with some areas losing up to half of their population. This tragic event forced society to rethink how they managed health and hygiene. Before the plague, public health measures were quite basic. There was little organization in sanitation or disease control. The only real effort was isolating those with leprosy. However, the arrival of the Black Death changed everything. Public officials began to implement systematic measures to control the spread of disease. One of the most significant changes was the introduction of quarantine. Initially, suspected plague victims and their contacts were isolated for about 14 days. This period was later extended to 40 days, which is where the term quarantine comes from. The first official quarantine was established in 1377 at the port of Ragusa, now known as Dubrovnik. By the late 15th century, quarantine became a common practice across Mediterranean Europe. In addition to quarantine, cities started to adopt sanitary controls. They set up observation stations, isolation hospitals, and disinfection procedures. Urban sanitation improved as cities developed clean water supplies and organized garbage and sewage disposal. Inspecting food became a priority as well. These efforts aimed to reduce disease spread in crowded urban areas where people and animals lived closely together. The plague also led to the creation of health boards and local government bodies. These authorities were responsible for enforcing health regulations. They oversaw street cleaning, the disposal of dead bodies and animal carcasses, and the maintenance of public baths and water quality. The rise of printing and town criers helped spread health information and enforce hygiene standards. Beyond immediate health measures, the demographic and social changes caused by the plague had lasting effects. With fewer workers available, wages increased, and laborers gained more freedom to seek work. This shift changed social and economic relations, which in turn affected public health by altering living conditions. After the Black Death, medieval Europe saw the emergence of organized public health measures. Quarantine, sanitation improvements, and health governance became essential. These changes laid the groundwork for modern public health by highlighting the importance of controlling disease and improving urban hygiene.